Welcome. Dr. Brazil
Hello.
and I are two members of the Neuro Oncology service at King's Health Partners. Dr. Brazil is a consultant clinical oncologist and I'm a consultant neurosurgeon specialising in brain tumours. And we've just finished what is a very typical consultation for us, where Dr. Brazil and I have sat together with the patient and their family, including family members joining in by Zoom, to talk about, with the patient, treatment options and management options for their low-grade tumour. And I think that the way that we discussed the case, the way that we came together as a team with the family and the patient, highlights an important aspect of how we deliver care here at King's Health Partners. So, handing over to Dr. Brazil.
So one of the problems is that when a young patient is faced with the diagnosis of a low-grade tumour, is that because these tumours are rare, we don't have the defined pathway of treatment for each individual patient. So this very much needs to be sort of teamwork to find out and explore what the best treatment options are for that individual patient. It's going to depend on both the location of the tumour and also the physical and psychological aspects of how that patient is, having had the diagnosis of a tumour. I think for young people, one of the most difficult things is that this diagnosis brings uncertainty, and we can't give patients certainty, but we can discuss in depth the options that we've got and the pros and cons of each option. And sometimes this takes really quite a long time because there are big decisions to be made. This patient in particular was wondering whether he should have further surgery for the procedure. And in this particular case, the surgery was not without risk, and the tumour was not able to be removed completely. And again, you have to take patients through the different scenarios of what might happen. And decisions can be very difficult for patients, and it's often a group decision between the clinicians, the patient and the patient's family.
Yes, I think I would really emphasise that point. One of the most difficult things for patients to deal with brain tumours and their families is the uncertainty of the diagnosis, the uncertainty of what may happen in the future. So whilst we're not able to predict for any one patient with any degree of certainty what the future may hold, we can give an indication of treatment options, we can give an indication based on the data such as we have it of what may happen, but more importantly, by engaging with the family, with the patient, to have long conversations, sometimes repeated conversations, where we're able to answer questions, answer queries, we're able to establish, I would hope, a degree of trust and understanding with the patient and their family that allows us to deal with the uncertainty of a tumour diagnosis and allows us to deal with the evolving condition as the years go by. Because what we really hope is that we can establish a relationship with people and their families that will last many years, because that will be for us and for them success in dealing with their tumour.